My name is Ryan Boynes, Communications 1010. It's May 24th, 2012. Today I'm going to be talking to you a little bit about acute respiratory distress syndrome. It's also known as ARDS for short. ARDS is an acute illness that sometimes occurs in critically ill patients, and if not treated rapidly and appropriately, can subsequently lead to the death of that individual. ARDS is a commonly seen disease process seen in ICUs and regular general hospital medical surgical floors. I personally have treated many patients in the ICU as well on regular medical surgical floors with this disease. First, to understand the management of ARDS, we must first discuss what the disease actually is. ARDS is defined as a buildup of fluid in the lungs, and the alveoli are unable to complete the oxygen-carbon dioxide exchange. With these abnormal levels of carbon dioxide in the blood, the internal peripheral organs are unable to complete the perfusion process, which is necessary to keep the organs alive. This process is extremely important in the sustainment of life because once tissue dies, it can never be regenerated or be reversed. As this process begins to unravel, the human body begins to manifest clinical signs and symptoms which are a clue to their caregiver that an anomaly is occurring. Signs and symptoms include difficulty breathing, which is also called dyspnea, increased or decreased respiratory rate, which is called tachypnea or bradypnea, a decreased tidal volume, where you're not getting a correct rise and fall of the chest, expansion, is what we want to say, cyanosis, which is a bluish coloration of the skin around the gums, the lips. What a common practice for nurses is to check capillary refill, and if their capillary refill isn't less than 2 seconds, we know that there's a perfusion problem or oxygenation problem. The patient is also going to exhibit some sign of altered mental status. They may be alert, be able to talk to you, but answer confusedly, but they may not be able to respond to you at all. Once these signs and symptoms have been presented by the patient, rapid treatment with oxygen therapy is essential in maintaining life. O2 management has to be spot on. With a nasal cannula, it's usually started out with oxygen at 1 to 6 liters per minute. And if their oxygen level, their O2 saturation, is still not within the normal limits of 95% or greater, then we want to switch to a Venturi mask. A Venturi mask will deliver a higher flow of oxygen. It's usually set on a percentage rate. If that doesn't work, then we're going to switch to a non-rebreather at 15 liters per minute. Hopefully that can keep their oxygen saturation greater than 94 or 95%, so we know that the tissues are being adequately perfused. Unfortunately, sometimes that doesn't work, and you have to move to further means of controlling their airway and ensuring that the tissue is being perfused. In that case, we want to put them on a CPAP or a BiPAP, which is continuous positive airway pressure. It's a large mask that most patients find is very uncomfortable, and it's hard to keep them on if they're alert and oriented. They want to take it off. And lastly, if the CPAP and the BiPAP is not keeping their oxygen saturation up enough, then we're going to have to endotracheal intubate the patient and put them on a ventilator and use vent management. Usually it's a respiratory therapist and a pulmonary critical care doctor that's going to be managing this situation. Lastly, once management is established, diagnostic efforts are then completed to verify the actual causes and sometimes the extent of the damage. Some diagnostic procedures include a stat chest x-ray, an ABG, where we can see their primary carbon dioxide concentration and their oxygen concentration in their blood, continuous pulse oximetry, where we can measure how well the tissues are being perfused, common lab work such as a CBC, that way we can see if they have an infection, their white blood cell count would usually be up. And also sputum cultures. Sputum cultures are very important in dictating what type of anti-infective, which eventually is going to fix their problem, that we need to give them. In conclusion, today I spoke to you about acute respiratory distress syndrome. We delved into some of the common causes, signs and symptoms, clinical manifestations, interventions, as well as diagnostic procedures associated with the disease. Unfortunately, this disease takes too many lives each year. But if we can continue to educate the healthcare professionals on the basics of this disease, I believe that many of these lives will be saved. Thank you. Have a great day.